Hi there everyone, Dr. Coletti, Baywest Health and Rehab, and on behalf of not only Baywest Health and Rehab, but also our cold laser protocols, which we are getting very closer and closer and closer to launching our software to the public and to physicians worldwide. We're very excited about that. But where that brings me up in this discussion is basically the opioid overdoses and the crisis here in the United States of America. And not just in America, but here being in America, we know this is a worldwide issue and problem of patients that are being prescribed opioid, just medications that are reducing their overall pain and discomfort. And you know, our way as myself in just a small private practice here in Florida, and prior to me launching our cold laser protocols to the world, is doing our part. And not just myself, Dr. Coletti, but you watching this video can do your part. There are other alternatives to pain medications for their pain. There just are. And cold laser is one of them. It's been around for almost 60 years now. And it's, you know, the proof is in the pudding. I mean, I've built an entire practice around it and built an entire software around it to go to market. The problem is human beings being in a speed for need. You know, this pill's going to get me out of pain quick, fast, and in a hurry. And you know, unfortunately, we as humans have to become a little more disciplined. And not a doctor giving a video, which we see all over the social media world, is going to be that one answer. Whether this view right here or this video gets me you know, 3,000 to 5,000 views or 100,000 views. It's not that. It's us, it's us mothers, fathers, grandparents, teachers, you name it. In a video like this is letting people know who are suffering in pain that there are other alternatives. And I'm going to tell you right now, find someone that understands and knows how to utilize their cold laser to not only short-term reduce their pain and discomfort, reducing inflammation and regenerating tissue. Cold laser therapy is though nothing is permanent, and I would never ever say that, but cold laser is there's no contraindications. It's not going to hurt them or make them worse. And you know, and a lot of times on a short number of visits, we average anywhere from 8 to 10 visits, depending on how chronic the pain is. But if it's an acute problem and they don't have any major chronic degeneration, 3 to 4 visits with a cold laser with someone who knows what they're doing with their cold laser can help reduce that pain significantly and get you back onto your activities of daily living and being that person whom you want to be, whether it's an athlete, whether it's a mother, whether it's a father, whether it's a teacher, whether it's just a friend, you name it. Get off of the opioids. Stop. There are other alternatives, and I think cold laser is up there. And yes, I'm a little biased because I've seen how productive and how amazing it's done within our practice. So I encourage you, if you're watching this video, share it. Cold laser therapy is our future in reducing pain, not opioids causing. And well, this study was a study done back in the Morbidity and Mortality Weekly Report just last month in 2018. In the United States, 30% increase in emergency room opioid overdose visits. And that was just between July and September, which looks like a 14 month period. I mean, it's a fast and moving epidemic, and it doesn't distinguish age, sex, state, or county lines. It's occurring with all of us. So again, I encourage you, if you know of somebody that is taking pain medication for a discomfort that they cannot, or pain that they cannot get rid of, there are solutions, and cold laser is number one. And regardless of my bias, I have seen it in private practice. I have a patient here in my office right now who's 95 years young, who ran lobster ships or lobster boats with over 400 lobster pots, and he is in Maine, 95 years young, and in just 4 visits, his pain level in his right knee went from an 8 to a 3. Now he's still here with us, and he's got about 6 treatments left with us, because not only are we going to get him out of pain, we are going to keep him out of pain. We are going to regenerate that tissue. So don't tell me if you're 45 years young or 55, you know, we are getting 95-year-olds to reduce overall pain and discomfort without the need or otherwise thought or opioid use. Stay away from it, okay? There's a time and a place for it. This video today is not to berate or barrage that, okay? There's when used appropriately a good time and a need for pain medication, but I'm telling you there's alternatives out there. Be disciplined. Seek out and find those utilizing cold lasers and who know how to use them to get you or a loved one out of pain. And be on the lookout for our software, Cold Laser Protocols, because we'll be going and hitting the market worldwide very soon. I'm very excited about that. That's all I have to say. Dr. Coletti, on behalf of not only Baywest Health and Rehab, but our Cold Laser Protocols, I am out, and seek out, please share this video, get the message out.